And with me today, I have the beautiful Dionne Collins, who is a dedicated therapist and counselor who blends clinical expertise with spiritual insight to empower individuals and families on their journey to healing and transformation. With a holistic approach to counseling, Dionne evaluates the whole person, addressing both inner and outer characteristics to provide therapy tailored to each unique need. Specializing in trauma, anxiety, depression, grief, infidelity, and behavioral challenges, Dionne employs a range of therapeutic methods, including cognitive behavioral therapy, Christian counseling, and didactic techniques. Her approach is marked by authenticity, empathy, and a commitment to helping clients take actionable steps toward lasting change. So, welcome to the show, Dionne. It's so great to have you here.
Thank you. It's great to be here.
Amazing. So I'm looking forward to finding out more about your own journey and more so, what inspired you to pursue a career in counseling and therapy?
So, ironically, this was something that I wanted to do since a very young girl. And what I've identified over the years is many of us that has have had a history of trauma or some significant crisis in our lives, we tend to go into the helping field, right? And so I always wanted to be a therapist, a teacher, or a lawyer. And I decided to get two out of the three. So this was always something that I wanted to do. And then I believe my actual calling was identified to counsel people through my ministry.
Oh,
Yeah.
fantastic. Okay. And can you share a moment or experience in your career that deeply impacted you as a therapist?
Mm, I have to be careful there because I'll get teary-eyed. I
Oh,
remember having this young lady some years ago, and she came into my office. I think she was around t in the 10th grade. She came into going into the 11th. She had a severe history of trauma. Um, her and her family were survivors of a cult, and she came into my office because her therapist was leaving, and they asked me would I be willing to take her. And so her first session, we had a little discussion. I thought we hit it off, and she had dealt with for years severe depression and anxiety to the point she barely can function socially. Um, and she had to do virtual schooling for part of the day. And she had been in therapy for a few years or so, probably a little longer, I'm not sure. But I asked her a question. I said, what if I told you that you don't have to deal with depression for the rest of your life? And she paused and she said, but I was told I did. I can just manage it. And I said, okay. I said, but what would the thought be for you? Would it be like if you could? And she said, I don't know. I never thought about it. And I got a call from her mom a few days later saying that she didn't want to return. And I said, well, why? And she said, I think my daughter really needs you. So I want her to return. But she said, when you asked her about depression, it made her fearful because that's all she had been living with. And she was told differently. And I said, just encourage her to come in for our next session. I'm gonna respect that she wants to end services, but just tell her I want to see her one more time to kind of clarify and give her some understanding as to why I said what I said. And if she still wants to discontinue services, I will be gladly to give her a referral. So she came back into my office and we talked, and I gave her some clarity and understanding as to why I said what I said. And she decided that she was going to continue therapy.
wow.
So fast forward it, she's in my office on her last session. Her and mom joined her. This was like 2 years later. She was graduating from college. got graduated from high school, and she had got accepted in a college in California for designing. And we all were in tears because she said, I never thought that I would ever feel normal. And she had been depression. She had her anxiety managed. She had a whole group of friends. She did her whole year, senior year in the school setting. She got the courage up to write to two colleges that she wanted and got accepted in one of them with a full scholarship. She never thought that was something she can do, especially being in a whole nother state from her parents because of the attachment disorder. And we just all cried, all in tears, and I was like, go and let your wings loose, my dear. Go and fly and be the beautiful eagle that you are, you know. And that was why I love doing what I do, right? Because I saw someone who was lost, broken, and struggled to maintain mentally, emotionally, and even spiritually, because they were a family of spirituality. And to see her no longer battle with that warfare
Beautiful.
and see her heal, a healed woman ready to begin her journey.
Yeah.
Mhm.
Love that. Oh, thank you for sharing that. Really
Yeah.
beautiful story. And yeah, it does, I feel like when you see people transform, from I guess the name on my podcast, from the victim to the victor, if you see it in your own practice, it just gives you that validation that, what you're doing is your sole purpose. This is what you've been brought on this earth to do. But your own journey hasn't exactly been, smooth sailing. You've also experienced a lot of, grief and loss. Did
Mhm.
you want to take us through your own journey as well?
Yeah, it's a very long one. So, as a child, my mom dealt with mental health. She was divorced. She divorced my dad at 3, and he remarried with a whole new family shortly after. I was 3, I'm sorry, when I was 3 years old. And my mother had, a serious history of trauma and abuse as she grew up. And so she had significant mental health problems. And so she was very abusive to me, emotionally, physically. But it was just something that made me knew she still loved me. She just was very unstable. And growing up in that environment, my grandmother, I call her Granny, she took me in and raised me at age 9 until my young adulthood. And I met my first husband, who was the father of my 2 sons, and he was very verbal and physical abuse. So I kind of just continued that pattern of abuse, right? And he was much older than me, so it was more or less, almost like an authoritative figure versus, a husband. And I began to shift my focus on my children when I started having children with him to the point of leaving, leaving that domestic violence relationship. And then I remarried, got into church, got saved, um, had 2 daughters by my then husband, and my youngest son at 21 years old, 7 years ago, was murdered. That was a tragedy, greater than any tragedy I've ever experienced. Um, it was just a really unexplainable pain. This is a pain you have to experience to be able to identify it. And then a year ago, got through that. COVID came, got through COVID. And then a year ago, I mean, just then last year, I was divorced after 25 years of marriage. I divorced my second husband. And I have been on this whole spiritual sabbatical and reintroducing myself to myself as a single entrepreneur woman with adult children versus, not taking care of anyone. I have a dog who now is another baby.
Addition, yeah.
I didn't realize that until I got her a couple of years ago, but I fell in love with her. So
That's
yeah.
beautiful.
So this is a new journey for me, and it's wonderful. It really is. As much as I love being a family woman, wife, and mother, this phase of my life, I'm focused on my career and my family.
Yeah. Oh, that's beautiful. Thank you so much for sharing that. And I'm quite interested in like your spirituality and how you utilize that in your practice.
So being a spiritual being as a Christian woman, um, it pours into the work that I do naturally. Whether my clients are looking for a Christian base or faith-based therapy or not, it just pours into my therapy. So I indirectly pour into my clients, that spiritual aspect of healing. What does this look like for you? How are you showing up in this world? What is the narrative that you are rewriting for yourself?
Yeah. Yeah.
Because that's when we can allow ourselves to heal, when we begin to change the narrative,
Mm.
of our suffering, of our story.
Very true. Yeah. And I just feel like as well, when you've been through so much loss, then faith, just having some like believing in something greater than yourself is the most healing. Like for me, it's always been the most healing thing, ever, because then it's not always just about you, is it? It's about something bigger.
Mhm.
You have something to live for.
And not even just yourself anew, just bigger than this world,
Mm,
right? Because there's a lot of tragedy in this world. So to be able to know that there's a greater power and force greater than this world gives you hope.
yeah.
Because that's the one thing that human beings actually only have to hold on to is that hope.
Yeah. Wow.
Mm.
And there's so many stories that that I've read where it was hope, that's they held on to, like the Viktor Frankl, that's one that comes to me, which was the Jew who was in Auschwitz, and it was just that glimmer of hope that he had, that one day he will be set free, and that's what kept him going, in the awful conditions that they were made to live in back then. So
Yeah.
yeah, just that hope. Thank you. And so, can you explain the importance of addressing the whole person in therapy?
Mm. Yes. Unless I am able to connect with the person sitting in me mentally, emotionally, and spiritually, that therapeutic relationship will be non and void. And so my whole goal is to know who that individual is sitting in front of me. And I would tease my clients sometimes. It's like, listen, I want to know all your business. So spill it out because if I don't know it, I can't help you, right? And being able to know what makes that individual tick, what their triggers are, what their joys are, um, understanding how they think and process information, having that conversation and understanding why what they're thinking is shaped so much by where they came from
Mhm.
and what their experiences were, helps me be able to um, guide them in that place of awareness. And I always tell my clients, I don't have a magical antidote to heal you. Your healing begins and ends with you. I am just a mental person helping you with helping and supporting you as and as you are going along your journey of healing.
Yeah, yeah. Okay. I love that. Yeah. And you also do assign journaling exercises and homework. for your clients. How does this actually benefit the whole therapeutic process?
And that is so funny you said that because I had a client yesterday and she was huffing and puffing. I said, don't be huffing and puffing with me. And I do understand that my clients have very busy lives, In my private practice, I most of my population are very very stressful and demanding careers. From nurses to attorneys to so I get that, right? But writing, as you know, because you wrote a beautiful book, writing is very therapeutic. And there's something about seeing um your thoughts and your feelings and your process on paper.
Yeah. Mm.
And I remember it was a couple, young couple, and I said, "You have your notebooks?" And they was like, "Oh, we got our phones."
Yeah, no.
And I just put my head down and say, young generation. And they just laughed and laughed. And they said, okay, Miss Dionne. A lot of them call me Dr. Collins, even though they know I don't have a doctor's degree. And they said, we're going to get our notebooks.
Love it.
And so I always explain to them it's a purpose for the madness,
Mm,
right? And many times I give them material to review and write reflections. What in that material did you identify with? What in that material, what were your takeaways? How did that material help you in processing and moving forward with how you do whatever the subject matter is? And they find that so helpful. They find it so helpful. And I can sit here and have a whole collaborative conversation with a client and give them insight, and I can give them material saying this, providing the same insight, and they have this epiphany, and I was like, why does that sound very familiar conversation that we had not too long ago? And they just start laughing. Well, I don't know, maybe I had to hear from a second place. I'm not offended. I love it, but that is one of the reasons why we have homework. That is one of the reasons why, I provide I approach things from a dialectic standpoint, right? Approach because therapy is a part of therapy is teaching. It is, helping, educating. And I want my clients to understand why they're feeling what they're feeling. I want them to understand, you know, and I try to explain to them a diagnosis is just what that is. It's something that the clinical world have to give to identify a series of symptoms, a series of moods and behaviors, but it doesn't define who you are as a person
no.
because you have a lot of individuals. Oh, I was diagnosed with bipolar, and that just really stresses me out, and I'm gonna always have this. No, but that's not the case. I know what the clinical world tells you,
Mm,
right?
it's
But let's
true.
talk about what's in here. Let's
Mm,
talk about what the spirit is speaking and how your spirit man is moving.
yeah. Yeah. Yeah.
Because you got to deal with the internal before you can even express and address the external behavior.
Yeah. Very
Because
true.
what's on the inside comes on the out.
Oh, I love
Mhm.
that. Thank you. Yeah, no, it makes a lot of sense. And it's like I just find there's so much diagnosis now with ADHD and um, Asperger's, and there's just so many diagnoses. And it's all, I don't know, I just see it all as, let's put a label on it. Someone's not
Mhm.
not the same as everyone else. Let's put a label on it. I just think,
Exactly.
when you talk to these people, they're just normal humans.
Yeah,
you know. But yeah, there's a stigma, isn't there?
very much so. Very much so. I want to say out of that tremendous tragedy of COVID, that the one thing that might have come from that is a decreasing of that stigma.
Well,
Because I noticed a significant increase in individuals seeking mental health for the first time.
yeah, yeah. That's good. Yeah. Fantastic. Yeah, there's, out of the negative, there's always a positive, isn't there? The polarities of life. So, yeah.
It sure it is.
So, in your opinion, then, what is the most important first step for someone beginning their journey of healing from trauma?
The first step would be awareness, being aware that there is concerns, being aware that there is healing that is needed.
Yeah, awareness it is, yeah. And I guess after that comes acceptance as well.
Absolutely. Because we can be aware of something and still be in denial. Um, I I don't know, are you familiar with Ayana Benzet?
Oh, yes, I am.
So in one of her talks, she had made the statement, and I said, that as simple as that statement is, it's very um is very profound. And she said, when we deny our reality, we will suffer. And it is so true.
So true.
It is so true. The more we live in our denial, the more we deny the very thing that contradicts the reality, we continue to suffer.
That is very true. Yeah. Wow. And I wanted to ask about the crisis center that you work at as well. So what are the main kind of challenges that you face at the crisis center?
Helping the homelessness, I would say, the homelessness. And two things actually, the homelessness and the insight. The patients having insight to their need for treatment, because there are patients that consistently come in
Mm,
for treatment, as you know, for medication, for um, you know, moments of crisis, because they are not ready or willing to get consistent treatment,
mm,
because a crisis center is the middleman. It's not meant to be your therapy. It's not meant to be your consistent treatment. It's exactly what it is. It's when you are in a crisis. And so patients are coming in there utilizing it as is an outpatient clinic, right?
okay.
And the biggest thing is they don't want to deal with the pain.
Mm,
Therapy is just not an easy process, especially when there's a history um, of trauma,
yeah.
right?
Mm,
Who wants to relive, re event and refeel those emotions and those thoughts and those experiences? No one,
nobody. Yeah, exactly.
and so I get it. But there also is that deliverance and that healing, and being able to look at those things from a different perspective,
Yeah.
that comes after going through all of that pain. There is some relief, there comes some peace, there comes healing,
Mm,
but it's just getting to that point.
mm, it is. Yeah, it is. It's the most challenging route, but it's the most rewarding route. Yeah. Okay, perfect. Thank you. And so how about for your own self-care? Obviously, when you're, dealing with so many clients in therapy and then also in the crisis center, what do you do to maintain your own sanity and, like to what do you do to actually take care of yourself?
Implement boundaries
Mm, good,
as
yeah.
number one. Um, Take time to be still, process, and shut off my brain. I do that every day, sometimes multiple days, depending on the day. um, I labor in prayer morning to night. I am I'm a very spiritual person, but I have my seasons where I get so busy being busy, and I become I get off course. And I realize it when something is off. I realize it when something is off, whether I go to the doctor and my blood pressure up a little bit, or whether, my eye is jumping or something. That's a sign that there's some stress or something.
Yeah.
And I was like, wait, and I have to wait a minute and say, wait a minute. I haven't did this and I haven't did that in the last week or two. And I have to reshift my focus, right? And get into gears. It happens. I'm human. We all human. So we have to just be very self-aware of, like, mindfulness. We have to be in tune with how we feeling, what our body is doing, how we moving. Does it make sense? And so that is what I do on a day-to-day basis. I shut work off at the door. I don't take any of that home. I give it to God. I pray on my way home from work. I get home and I do whatever it is I need to do in that space. And when I start working in my private practice, because some days I shift from one job and I go into seeing patients in my private practice virtually. And I go into prayer before I see those patients. And I shut that down and I rest and sleep very well at night.
Oh, I love that. Yeah.
I have a whole bedtime. I don't play with my bedtime. My kids laugh at me. My little young adult kids laugh at me like, Ma, you have a whole bedtime. Only old people have. And I was like, we're not going to do the old jokes, okay? Yes, I get up at 3:30, 3:45 in the morning. So I need to be in the bed by 8, 8:30 at night, no later. So um Sundays, my one day, as long as I can remember, that has always been my non-negotiable day. Family, church, and relaxation. I would never work on a Sunday.
Oh,
I don't consider this being work,
no,
even
this doesn't work.
even though um I Sunday was like my only, so I wanted to be able to have this, platform opportunity. So I said I'll do this because for me, work is a part of my spirituality as well.
Yeah, yeah, absolutely. Wow, thank you. And so are there any practices or habits that you could recommend for my listeners who may be seeking to maintain emotional and mental well-being?
Yes, yes. Allow yourself to be still at times and don't always be busy being busy with the world. Set time aside for you because we all wear many, many hats, especially women. But I don't want to be biased because I know there's men are just as busy, but we all wear so many hats a day, but we're only one person. And be in touch with your vulnerability because many of us, men and women, vulnerability is foreign language, right? It's foreign language and it's not very easy to be. When we feel vulnerable, there's a sense of anxiety and fear that happens. Some of us are not even vulnerable in our most intimate spaces. So learn to be vulnerable and put yourself first. It's not selfish, it's selfless. Put yourself first. Have very healthy boundaries with work, with family, with community, socially, and with any habits that can become a bad habit. Put those boundaries in place.
Beautiful. Thank you. Wow, dear. I love it. I just love your nurturing way that you speak and just your advice. It's just phenomenal. So, my listeners, where can they find you, connect with you, or even work with you?
So I work in Michigan. I'm only licensed in Michigan currently, and you can find me. My office number is 313-510-1290. And I don't have a website anymore, but I do have a profile on Psychology Today. And you can either Google and put in mental meeting the need counseling or my name, Dionne Collins, and I should come up.
Fantastic. Yeah, and I will be leaving the links to all of that in this episode as well. So yeah, that's been phenomenal. Thank you so much for your time today, Dion. And I'm sure that my listeners would have benefited from your amazing guidance and your wisdom that you have to share. And yeah, I've really loved this talk. Thank you so much.
Thank you, Anu. Have a good day, my dear.
All right. So that's all we have time for, my beautiful people. And stay blessed, take care, and I'll see you in the next episode.